I'd like to introduce our next speaker. We are going to be talking about medical management with Dr. Timothy Lukovits. Dr. Lukovits is a vascular neurology specialist out of Lebanon, New Hampshire, and he has over 29 years of experience in the medical field. He is the medical director of the Cerebrovascular Disease and Stroke Program at Dartmouth Hitchcock Medical Center. He is also an associate professor of neurology at the Geisel School of Medicine. We are really looking forward to hearing from him. So thank you so much for being here, Dr. Lukovits.
Great. Thank you, Lisa and Dean. And I'm very fortunate to be here. And I've wanted to take us to more of the day-to-day issues and things that happen to people with moya. And, there continues to be a lot of things where there might be a role for a neurologist after the diagnosis is made. So I wanted to talk to the patients and the families to raise some of these issues and indicate that there might be some special considerations because of the condition. So let me go to the, okay. So last year, the American Stroke Association came out with a guideline that specifically mentions the management for moya patients, and they do talk about surgery. And this is all they had about medical management and for that. And they said that in patients with moya disease and a history of ischemic stroke or TIA, the use of antiplatelet therapy, typically aspirin monotherapy, for the prevention of ischemic stroke or TIA may be reasonable. And the letters to the left are basically indicating there's very little evidence, kind of very weak evidence about what should be done. So I wanted to see Dean's face if I ended my talk right here, but I decided not to do that. And I wanted to talk about the other issues as well and raise two questions basically. One is basically, are standard stroke prevention measures applicable to a non-atherosclerotic disease like moya, and how are the secondary issues managed, things like headache and seizures, despite the diagnosis? So this was similar to the slide Dr. Ogilvie showed, basically indicating that this is not an atherosclerotic disease like most stroke, but there's still, possible things that can develop in your other arteries. And as you can see, and you very well know, patients with moya disease do grow up and they end up having, normal life expectancies, and they may have other types of vascular disease. So these are still things to consider. So as you heard, antiplatelet medications like aspirin are usually used. And I'll talk a little bit more about that. And then basically general measures to keep all your other arteries healthy is encouraged. So cholesterol lowering medications are sometimes used if they would be used for primary prevention of atherosclerotic disease. Blood pressure is a particularly tricky topic, but sometimes they are used in patients, but with caution if they have very elevated blood pressures. And there are important lifestyle modifications to have a healthy cardiovascular system if your traditional risk factors are present. And obviously smoking cessation is very critical. We always talk about the importance of dehydration and avoiding it and situations that might result in low blood pressure preceding ischemic events. And that also is important. And as mentioned by Dr. Ogilvie, there is this risk of hemorrhage, especially later in the disease. And as an adult neurologist, I see this more. People become middle-aged or older. So blood pressure becomes even more important because that's an important risk factor for hemorrhage. And we need to use care when considering the ongoing use of antiplatelet agents and anticoagulants. So people can get other conditions like atrial fibrillation. It becomes a tricky topic, and that needs to be considered carefully. So let me talk about some of these secondary issues and how they're managed. These are just some of the more common important problems, and I'm sure people who are very familiar with this. So headaches, seizures, and I'm going to mention contraception and questions about that. I'm not going to have time, but these are very important questions as well, like is pregnancy and delivery managed? And what about other stroke-related complications like depression, anxiety, spasticity? So these are all very important and they are treatable. This is a typical patient who has headaches. It might be a tension headache, but we often see migraine type headaches. And you can see these occurring before surgery. Sometimes they're lessened by surgery. Sometimes they get worse with surgery. But they're common in young, especially more common in younger women. So this is a very common situation. Now, as far as medications that are used, typically the migraine type of medications you might be familiar with, like triptan, sumatriptan. Usually these are avoided because they can cause vasoconstriction. We're not really sure how dangerous they are, but we avoid anything that might cause narrowing of blood vessels temporarily. We usually say that NSAIDs or anti-inflammatory medications like naproxen are safe, and they should be used occasionally only. And then you may know that they sometimes use botulinum toxin injections in the muscles of the face to prevent headaches in people who get frequent migraines, and those are allowed. And there are preventative measures, including medications that can be used to prevent frequent migraines, and most of them are safe. And also lifestyle changes are important for preventing migraines if you have particular triggers. Now, one thing I want to mention that people may not be familiar with, and it's also touching upon the research and developments that are occurring with molecular medicine, is that there are some new medications that came in 2019, and they act against a pain chemical called CGRP. And these seem safe in patients who are at risk for cardiovascular events, but there's not a lot of data about actual use in patients who have either coronary disease or vascular conditions like moyamoya. But this is a possibility, and neurologists may use these in patients like yourself. This is just a little cartoon in a recent publication. It just shows that in a migraine, it's actually also an inflammatory condition. So it's showing that the trigeminal nerve at the base of the brain is generating the pain, and it's releasing these molecules, which is a type of protein called calcitonin gene-related protein. And that's released and throughout the soft tissues of the face and the head, and that leads to the pain. And now the other cartoon on the right shows that there's these little molecules, the little orange circles again are the protein. And there's two ways now that this can be blocked. And there's medications now that were designed to do that, and they can prevent migraines and also stop one during a very severe migraine. So these treatments are either like the little antibodies, the little Ys are antibodies, monoclonal antibodies that can block the receptor so that the protein that causes the pain can't get at it, or the more gray ovals are other molecules that can block the receptor as well. So this is very exciting because a lot of our patients who get migraines might have vascular disease, and this looks like a potential important therapy for them. So seizures, as you probably know, can occur often because of ischemic strokes that occur on the surface of the brain. And there are many good medication options. And some of the medications are preferred because they usually cause less cognitive side effects, which patients with moyamoya disease may already have. And because a lot of patients are young females of childbearing age, there are some considerations about which medications are less likely to cause birth defects. So one, lamotrigine is one that's favored because it causes less cognitive side effects and it seems to be safe for the baby. So there are important triggers, like with headaches, that should be avoided, and sleep deprivation is a big one that can lower your seizure threshold. So there are very important things that can be done for these seizures. Let me touch on contraception. I'm not an expert on this, but some of you who have gone through this probably could tell us about your experiences of trying to select one that's safe and effective. But usually the options that include estrogens are usually avoided, but the actual risk in moyamoya disease is unclear. But the concern is that they can, estrogen might promote thrombosis and could lead to artery occlusion and a stroke. So those tend to be avoided. And so instead, the ones that are avoided are the typical, like combination oral contraceptives, estrogen patches, estrogen rings, things like that. The ones that are usually discussed as being safer are ones that include progestin only. And those include some that are probably safe, but not necessarily convenient or easy to use, like injections, Depo-Provera, maybe for younger people who aren't reliably going to take medications. There's the implant in the under the skin called Implanon, or there's some other ones that could also be safe and lead to high adherence. And then there are a couple of progestin intrauterine devices, or IUDs, like the Mirena, and there's others now that you might be familiar with. And then there's the mini pill with progestin only as well. But some of these don't have the sometimes positive effects of the estrogen that might help with some of the symptoms that come with the menstrual period. So there's kind of a trade-off with these. The ones that often get discussed as sort of being optimal might be the non-hormonal therapies, such as the copper IUD. It's one of them is called Paragard. And then there are other methods that seem safe but may not be effective, as effective, and those are barrier methods. And then even sterilization of them for men or women can be considered. So wrapping up, but giving us some extra time, I do think the possibility of a registry might be very helpful as far as knowing how to manage some of these other issues, because there may not be trials that test effectiveness for some therapies specifically in the moyamoya population. So if we have a large group that has probably a lot of people will have these issues, and we know how they're managed and what complications may occur, that could be another important benefit of a patient registry. And that may be both for patients who are prone to ischemic and hemorrhagic stroke, and again, how to manage these other issues. The other thing that was mentioned by Dr. Ogilvie is I think there will be other potential medical therapies in the future that might come from this gene editing, medications that might promote the good angiogenesis to prevent ischemia and protect the blood vessels from the deterioration that occurs. So that's all I wanted to mention tonight, but I'll be available for questions.
Thank you very much, Dr. Lukovits. I think that was great information for so many of us, and in a very nice way to kind of think about things. I do know there were a couple questions on Facebook, and I'm just looking. I think we might save questions for the end, probably even after the panel. We might come back and do some questions. So I think that's what we're going to do. But little did you know, you segued perfect into our next presenter. So again, thank you so much for being here, Dr. Lukovits. We greatly appreciate it. But we at the Moyamoya Foundation